Good afternoon to the daily briefing here at St. Clair County EMA. I'm joined today with Brian Whitaker, the Assistant Director of EMA. Chairman Kern and Sam Bierman has finally got a day off. We gave him a pass and said, take a break. It's been about 90 days, so you're stuck with us today. Brian, you get to do the honors of the numbers.
I'm not sure how much of an honor it is, but I'll try and do as well as Sam does here. So, St. Clair County numbers for today: we have tested 11,041 subjects. We have had 1,610 positive cases, which is an increase of 41 for today, and those are males and females from the ages of 20s through their 90s. We've had 9,284 negative tests and have 147 tests pending. Unfortunately, today we also sadly are reporting one additional death to bring our number to 124, and that is a male in his 80s who did have underlying health conditions. For those subjects who have completed their IDPH required 14-day quarantine, we are at 1,094. For state totals today, they have tested 1,168,945. Positive test results are 131,871 for an increase of 673 today. And deaths statewide are at 6,289, which is an increase of 29. For hospitalization numbers, and that is for those currently hospitalized in St. Clair County hospitals with COVID-19 related illness, we have 47 patients, and 5 of those patients are on ventilators. And for our congregate living facilities and outbreak status in St. Clair County, and that includes facilities with 2 or more staff and or residents with COVID-19 positive or symptomatic, we have the Atrium of Belleville with 2 cases and 0 deaths. We have Brea of Belleville with 48 cases and 6 deaths. We have Brea of Cahokia with 23 cases and 2 deaths. Caritas Family Solutions of Belleville with 12 cases and 0 deaths. Caseyville Nursing and Rehab with 3 cases and 0 deaths. Cedarhurst of Shiloh has 12 cases and 0 deaths. Cedar Ridge of Lebanon has 58 cases and 4 deaths. Colonnade Senior Living of O'Fallon is 6 cases and 0 deaths. Four Fountains of Belleville is 104 cases and 27 deaths. Help at Home in Belleville has 2 cases and 0 deaths. And Help at Home in O'Fallon has 5 cases and 0 deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center has 54 cases and 10 deaths. Memorial Care Center in Belleville has 44 cases and 5 deaths. New Athens Home for the Aged has 55 cases and 6 deaths. St. Paul's Home has 45 cases and 14 deaths. Swansea Rehab and Care Center has 28 cases and 4 deaths. And finally, TDL Incorporated of Belleville has 4 cases and 0 deaths. Herb?
And we'll move into the zip code report. And remember, and you'll see today some of these zip codes go up, go down. And as Chairman Kern tells you every day, that's a variety of reasons. Patients move when their information was given. Maybe they provided the wrong zip code. And once that is corrected, then we update that as quickly and as accurately as possible. So we'll go into the daily zip code report. 62059 is at 7. 62201 had an increase of 10. We're at 38. 62203 is at 48. 62204 went down 1. We're at 56. 62205 went down 1 with 64. 62206 increased by 6. It's now at 138. 62207 went up by 3. It's at 93. 62208 is at 85. 62220 is at 154. 62221 is at 133. 62223 went up by 2. It's now at 63. 62226 went up by 4. It's now at 172. 62232 went up by 1. It's now at 29. 62239 went down by 1. It's now at 15. 62243 is at 8. 62254 is at 62. And 62255 is at 6. 62257 is at 11. 62258 is at 17. 62260 went up by 1. It's at 13. 62264 went up 1. Now at 51. 62269 went up by 2. It's now at 90. And 62285 is at 18. And Brian, I think we have what, 32 zip codes?
We have portions of 38 zip codes here in St. Clair County, but of all the zip codes that lie solely in our county, we've only got 3 left that aren't reporting.
And of course, as we always say, that in order for that zip code to be reported, it has to be 5 or more cases that's been reported in those zip codes. So
Correct.
Just because you didn't hear that, your zip code doesn't mean there is no active cases there. It's just that they haven't met that threshold yet.
Correct, and we do have some zip codes that we share with surrounding counties in the Collinsville area, down in the Columbia area, over to the east to the New Baden area that are reported in other counties, but we do have little portions of our county that are in that zip code. So totally 38 zip codes, but not all of them solely in St. Clair County.
Yeah. And we're joined here also today by Randy Randolph, the operations manager for EMA. So we want to take a few minutes. We talked yesterday briefly with Sam and the chairman about the long-term healthcare facilities, and I thought it was needed to be talked about again today. One of our St. Clair team members, Mike, mentioned yesterday that his mother had been tested positive and is in a nursing home, and I thought that was admirable for him. He follows us every day. These long-term healthcare facilities are doing the best job they can, as we know.
Absolutely, and as you guys talked yesterday, there was some erroneous statements about we should just close them all down and that would solve it. That's not going to solve the problem. The staff at these facilities are working tirelessly day in, day out to contain the spread of this virus and keep the residents safe. And for those that don't have it, their way of life has changed dramatically as well, with not being able to visit with friends and family members, very limited movement within the facilities, having to eat meals in their own rooms and stay away from others. This is a trying time, not just for the residents, but for the staff of those facilities, and we have to commend them. I mean, we've talked with dozens of facilities throughout the county here, and they're all working tirelessly to maintain this spread.
Well, and Randy, as we talked about, for somebody to have a loved one in either in a long-term healthcare facility or at the hospital, and family members and friends can't come and see them, that takes a toll on everybody.
It does. I mean, my grandfather is in an assisted living facility, and our family, none of us have been able to see him for almost, 3 months since they locked down before even the state said we needed to. And I know, talking to him on the phone, he's frustrated, and he's always been a people person. So here he is dealing with this, and he had just gone in there just a few months prior to that. So not only was he adjusting to that, but now he's dealing with this, that he can't see his family. And the other thing that we have to look at too is the sheer number of people in those facilities, in smaller confined spaces, and the staff members that are working so diligently to provide for those loved ones. Truly is what they are. They have to leave and go home at some point and take care of their families too, and so those double stresses of being concerned about if they're going to bring that home to their family or potentially bring it back to the people that they're caring for, I'm sure it's got to be overwhelming.
Well, yeah, it's the same with all of our first responders. We reported one day earlier in the week they were seeing a increase in our EMS personnel.
Yep.
And those are the men and women that are getting that 911 call to respond to whether it be the long-term health care or to a private residence or to a place of business. Because I think that's the myth that's out there also, as we've been talking about, that it's only in these long-term health care facilities.
No.
It's in the businesses, it's in the homes, so it's everywhere.
Well, you mentioned those efforts that went into place in the beginning to lock these facilities down early, and I think that's because of some of those proactive measures they took. That's why we saw it take longer to get into those facilities. Initially, we were seeing less reporting in the long-term care facilities,
Right.
And now it's starting to get in there more. And part of that could be tied to the fact that as we open up more outside of the facilities, staff that work at those facilities could be unknowingly
Right.
bringing virus into there, and that's the last thing they want to do. They're taking every precaution possible, and we're still seeing some spread.
Right, because they all have lives too to live and things that they have to take care of and to do, and they can't solely just go, from work to home and back to home and not stop at certain businesses and grocery stores and things like that to take care of what they need to. And I was really disappointed today. I stopped and I was there were 2 people in the gas station wearing masks, and there were probably 10 other people that were not. And you want to talk about a closed environment.
Well, I think that's why we remind all of our followers every day to spread the word, practice the social distancing. We put up that graph yesterday about the states.
Yeah, and really the states, as far as the state as a whole, and even here in the county, we do have unfortunate circumstances like Randy's talking about, but over the last 14-day period, based on that article released by the New York Times, Illinois is the largest decline in new COVID cases over the last 14 days.
And I think that's a plus to all of you who are following what those guidelines are, practicing social distancing, wearing the face coverings when you're out. That's something that we can all be proud of, that out of all the states, we are showing the largest decrease. So that tells me that a lot of yous are doing what has been recommended. Yes, as Randy said, and it's obvious. I'm sure all of yous have seen out there that you've been in some places where people have the face coverings on, and a lot of them don't.
Right.
But our concern has been we're ready to go into phase 4 here come June 26th, and all of our numbers are being where they are. We see that roller coaster, where we get concerned about that, especially when it goes up several percents over a day. But overall, we're where we want to be. We want to be on June 26th, moving into phase 4.
Absolutely, and when we looked at that chart, the United States is kind of about 50-50. There's 24 states that are on the decrease. There's 23 states either increasing or strongly increasing, and 3 holding steady. So really, this virus is still predominantly here in the United States. And while some of these measures like social distancing and wearing a face covering are inconvenient, they're working.
Right.
They're helping, and they're allowing us to reopen some of those business and industry that were closed, because the only other way to keep this down is to shut everything back down.
And nobody wants to do that. I mean, it's just, I know we don't, and everybody that watches this, that but we got to be able to control it the best we can until a vaccine comes up with. And there's all kinds of theories out there. It's going to be one will be ready by the end of the year, early fall. Nobody really knows, I don't think so. And it's not for us to say when that's going to happen. We need to just try to do our best to keep the spread down.
Yeah, and anyone who thinks otherwise would be foolish to think that we are not as a group are struggling with some of these things also. Not that we don't want to do it, but because it's just gone on for so long, and a lot of people lose hope after a certain period of time. But we have to recognize that the moment that we stop doing what we're supposed to be doing in preventing the spread of this, that all the liberties and things that we take, that we appreciate so much in the United States, that we're going to have to go backwards again, because more people are going to start dying, more people are going to get sick, and that's the last thing that we want to do. Yeah, we want it to be over with, but it's got to be over with when it's over. Not when we just say it's okay.
And believe me, this is not job security.
No.
We've got plenty enough to do. If anybody thinks that Chairman Kern and Sam Bierman want to come in here every day and continue to do this for another 3 months, they're sadly mistaken. You guys, all of us have other chores we have to do. County business still has to go on, and it's been going on.
Yep.
You know, Chairman Kern has had to make sure that the county continues to run for the last 90 days.
Right.
You know, bills had to be paid. You know, had to do meetings by virtual
This is just
meetings.
on top of everything.
This is on
else.
top of everything
Yeah.
else, and so that's why we are so adamant about everybody following the social distancing, the face coverings, because we want it to get over with. We want people to get back to whatever that new norm is going to be.
Right.
And again, the one thing that I know, and we talk about it off camera, the one thing we've learned that there are people out there, no matter what we tell them, no matter what we show them, they've got their own opinions made. And I think over the last 90 days, we've come to live with that. They're entitled to their opinion. We tell them that on our answers that we give them at nighttime. You can come on here and voice your opinion as long as one is respectful, and we're not going to allow any of that foul language. We had to block a gentleman last night that thought he could get on there and say a few of the words that shouldn't be. And so we will do that. But if you want to come on and voice your opinion, we appreciate everybody who has become a part of Team St. Clair.
And there's been a lot of really valid questions that have come through too.
Yes, a lot of them.
You know, some that they're not confrontational. They're just like, hey, this is what I think. Tell me, educate me. And a lot of times you educate the people with the data, with the information that we have, and they're very receptive to that. And like I said, there are a few of the dissenters that just will never be happy no matter what you say.
Right, and I think we've made that abundantly clear to them that, you know, we're not here to replace their news source. We said from day one, when Chairman Kern said we needed to make sure our county was informed of what's going on, and that's why we came up with, we'll do a daily briefing, give them the most up-to-date, accurate information, working in conjunction with our partners at the health department and wherever it may be, and I think we've done a good job of that. There's been hiccups throughout the whole ordeal, but we've gave them the up, and if there was a number that had to be corrected, we came right back and did that.
Exactly.
And we've got the system down. That's why we were able to give Sam off today and the chairman off, because after 90 days, they needed a little break. Doesn't mean the virus is gone.
No.
They'll be back here tomorrow for a question and answer session.
Another big day, a favorite day from a lot of our followers. They like the opportunities to throw those questions out there, and as we will do, you guys will answer as many of them as you possibly can. Some will need additional research, and others aren't looking for an answer.
Right. And we truly appreciate, as I said, everybody being a part of Team St. Clair. I got to give a shout out to my number one team member, my wife. It's her birthday today. Happy birthday, hon.
Happy birthday.
We appreciate you following us every day, and for everybody who takes time to stay up on the latest information of what Team St. Clair is doing here for the entire St. Clair County. So we'll be back shortly. I think we have Cindy today to translate this into our Spanish-speaking communities, and of course we'll be back tomorrow afternoon for the daily question and answer. Chairman Kern will be back, and also Sam Bierman from the health department. Everybody have a good rest of the day, and we'll see you back here tomorrow at 3:30. Thank you.